Hello, everyone. So, a year ago, by this time, I was in the same dilemma, medicine versus pediatrics. So, this dilemma arose because both are medical branches, both have this diagnostic work, both have the thrill. But at some point of time, you feel that there are some pros of medicine, and there are some pros of pediatrics, and then you get a rank where you can choose both. And then this thought arises whether you want medicine or do you want to do pediatrics. So this has been a long debate. My rank was 838, and this question had uh, taunted me for almost 3 to 4 months. And after spending so much time in talking to people, doing my own research, and analyzing myself, and uh, coming in peace with my inner self, then I realized that I had taken the right decision, because it has been 8 months down the lane, and I have never regretted the decision that I took even 1 second of my life. So, coming over to medicine versus pediatrics, these are the general considerations which you will get in any YouTube channel or any motivational talking where, or a debate where medicine versus pediatrics is considered. So let's have a little bit depth discussion about this. First thing is medicine versus pediatrics. What is common for both of this? Okay, so the common thing for both of this is that both are having diagnostic workups. Like what I say to everyone who asks me which branch should I choose, I have no idea. The first thing I ask them is two questions: do you want clinical or non-clinical? Second is, do you want medical or surgical? By the end of internship, you would be knowing what you like. You'll be liking surgical branches or medical branches, not specifying anything. Or there is some others category where other than these two fit. So if that is the case, then you don't have any dilemma. If you want surgical, there are options. Coming to medical branches, then you have mainly four options. That is medicine, dermat, radio, and pediatrics. So all these four are mainly involved with the diagnostic workup, investigations, and there are less hands-on. Even though you'll get procedures to do, there are less hands-on compared to surgical branches. And these are mainly academic branches, and this should be studied under the guidance of some people. It is not like you can go and study this, because there should be a person to always guide, in contrast to surgical branches where you can pick up skills with as much hands-on as you do. So now, first point regarding medicine is that nowadays DM is a must. I again put a tag. It is a must in metropolitan cities and in tier 2 cities, but in tier 3 cities and towns, MD medicine is enough. So whether you should do DM after medicine, or you can settle with just MD medicine, totally is dependent on an individual. If you just want to, there are many people who flourish just with MD medicine, but the dictum nowadays is that DM is a must. Okay, so this puts us to uh, a topic that medicine will be a longer, because residency is the toughest phase of life, and if you want to get to do away with residency as soon as possible and you don't want to do DM, then you shouldn't consider medicine, or you should consider medicine and settle in a setup where MD medicine is enough for you. So DM medicine means that you'll have to struggle for more years. You have to give one more entrance exam. You have to top that entrance exam, because DM super specialty seats are even less compared to MD medicine. So when I got the rank of 838, this story happened with, this is my true incident. Okay. So I was from the very beginning focused towards medical field. I know medical branches. And then I also knew that in counseling, anything can happen. Nothing can be expected. So I had kept my options wide. So I had kept my priorities as medicine, pediatrics, dermat, and then radiology. So in medicine, I realized that there is need for super specialty. So when the Kerala state merit list was expected, I had appeared for Kerala state medical counseling also, and there in the result in the merit list for the year 2021, my rank 830 was carrying a state rank of 65. But when it came to 2022 year, a rank all India rank of 830 carried a state rank of 109. You see the difference. There is a lot of difference. 65 to 109. There is a difference of 45, 44, 45 ranks. So for a rank of 65, I would have got the topmost medical college in Kerala. but suddenly I am even doubtful of getting medicine college in Kerala in the first attempt. That is because Kerala has only 6 medical colleges, and out of those, only 5 are actually good, and out of that, only 2 are the topmost medical colleges. So this is one lesson which I learned, that you can't expect anything from NEET counseling, because for almost a month I was in the impression that I'll definitely get a college, medicine college in Kerala via state counseling. But then when I saw the state merit list, I knew that nothing can be expected. Okay. So this pushes us to the point that if DM is to be done, then you have to plan for your if DM has to be done in medicine, then you have to plan for your super specialty exam. You should have sufficient time available. If you're doing MD medicine, and then if you want to do DM but you're not able to do DM, what are your options? You should be thorough with that. And third thing, if you're doing DM, then you should be really thinking about long term. Like, the endurance concept works so much here. You should be like, by that, even if you get everything in the first attempt, by the time you will be a super specialist, it will be definitely 30. No one becomes a super specialist before the age of 30. So then again, to settle in a tier 1 or tier 2 cities, it takes 4 to 5 years. So it's a long course. So here the concept comes about settling early versus settling over a long period of time. So here comes the concept of endurance. If you're ready to go ahead with this long plan, and you like the branch so much, and you're confident that you're going to do DM and you'll get a DM seat, and if you're very passionate about the branch, you'll definitely will. If you have positive thoughts about the branch, you'll definitely will. So then I think you should go for MD medicine. So next thing is, which I asked many people was, when to take medicine college, which medicine colleges to take. So the chorus opinion that I obtained was that take medicine in a setup where there is super specialty workup. I asked this to a third year PG, I asked this to a second year PG, I asked this to a senior resident, I asked this to a consultant, I asked this to a super specialty consultant also. Everyone had the same answer, that you should take college where there is super specialty workup. This is because when you are going through various phases of MD, the super specialty workup will actually make a lot of difference. Me being from a state college, now I'm doing my post graduation from a central institute where there are super specialty consultants. I can clear cut see the difference in management of cases, the workup that happens, the amount of investigation, the end result, the patient care, the patient outcome that happens, especially in medical fields, I'm saying, is a lot different from where there are no DM candidates, or where there are no super specialty approaches. So that's why my focus, as told by my faculty, as told by my consultant, as told by my mentors, was that if you are able to do MD from a topmost medical college of the state, because obviously there will be super specialty approach, and from colleges from central institute, then you definitely should take medicine there. For example, that's why when you see my priority list, you will see that I have put all the options of medicine which comes under that category. For example, central institutes like RML, VMMC, AMU, BHU, all these things are central institute which comes under which have medicine super specialties. Then second option will be state top colleges. State top colleges like for Karnataka, BMC. In Karnataka, there's only BMC which has all super specialty approaches. Like you have DMAS, you have Jayadeva, you have nephrology separate hospital, you have gastro separate units. So these type of super specialty workup will happen there. So then coming to Kerala, you have Trivandrum and Kozhikode Medical College. These two colleges have the super specialty approach. So whenever you are asking about any college in for medicine and you want to do DM, then make sure that those colleges have super specialty approach. Now, I'm not discouraging those people who are very passionate about medicine, are ready to take it anywhere across the country, and they just want to do MD medicine and then think about DM. It's not that people who have done MD from peripheral colleges have not become good super specialists. There are many examples where they have been. But if you want to be a very good physician at the end of 3 years, and you want to be a very good super specialist at the end, because I believe medicine is such a branch which has a lot of competition. Like the topmost from the NEET UG will take medicine as their career, MBBS as their career, and from that topmost will take medicine. And from that topmost medicine, people will take super specialties. So you are in the creamiest of the creamiest layer. So if you're very sure that you are able to, if you want to do DM in and you want to come out as a very good super specialist, then it is advisable. It is not necessary. It is advisable that you do it from a very good institute. Very good institute means where super specialty workup happens, where patient care is optimum, because in these colleges where super specialty workup is there, protocols are followed. When protocols are followed, patient care is optimum, and these same protocols are asked in entrance exams. That's why you'll see that colleges, students from AIMS especially, they don't have difficulty attempting for entrance exams because, and most of super specialty seats are grabbed by them because they follow these protocols on day-to-day basis. Okay, for if I ask any college people like how will you do what are the, like if a MCQ question comes in pediatric nephrology DM entrance exam, like which of the following is not true regarding pediatric uh, uh, pediatric hemodialysis. AIM student will definitely attempt it, right, because they do the hemodialysis pediatric patients on day-to-day basis. There are very few facilities available all over India where pediatric hemodialysis is done. Okay, there are very few facilities available. So don't expect a state college student to know this answer without reading about it. So this is the point, that if you want to do medicine and come out as a very good super specialist and your journey be smooth and easy, and then you get everything in a first attempt and be a tough competition with the tough competitors, then you should choose a college which has good good super specialty workup. The second point is MD medicine versus pediatrics is that pediatrics is very flexible. This is one of the main reason why I chose pediatrics, because at the end of internship, I don't know whether I'm going to like medicine or pediatrics. See, whatever the branch you like and the branch you get is like arranged marriage and love marriage. Love marriage is your dream branch, you're getting that dream branch. Arranged marriages, you're getting the branch which you didn't desire, but then you have to adjust with it and maybe you'll fall in love with it. You'll definitely fall in love with it. So my concept here was that even if you take a branch which you like partially, you will definitely like it on the long term, because anything which you do for a long term, which becomes a routine, will stay with your life. So now I had this confusion. If I take medicine from a peripheral institute, or maybe if I take medicine from a good college, and what is the probability that I won't like medicine? So you should think about this also. Like there are few people who took, for example, surgery and ortho. This happens with surgical branches because surgical branches are physically and mentally exhausting. So they take surgery or ortho because someone has said, or because they have got a good rank and they take it. And they think that they take it because they like it, they have passion, and once they enter and they actually experience it, then they realize it that this is not their cup of cake. So it's that is also a possibility. So you have to consider all possibilities in your mind before you choose, before you are in such a dilemma. Okay. So pediatrics is one such branch where there is lot of flexibility. I'll tell this because when during my internship I had done only 1 month in medicine, and that to an intern's job. I had not no much exposure towards what actually a resident does. So secondly, even pediatrics was for 1 month, but there also I don't have much exposure. So I don't know what to expect from pediatric residency and medicine residency. I can just take opinions. I have not experienced both of them. But if I don't like medicine at the end of 3 years and I wanted to do DM, then it's difficult process for me, because I have to stay for 3 more years and then I have to do super specialty. So it becomes a long process, and then maybe I may not like it on the long run, etc. But pediatric provided me the flexibility, because after 3 years you don't like residency, you can don't like to continue, you can just quit with the MD, because many peripheral, like tier 1 is saturated for pediatrics, but tier 2, tier 3 has very good scope for pediatric, especially the peripheral areas. Pediatrician is very less. My hometown actually has very less number of pediatricians, and this flexibility and this scope for pediatrics actually gave me a boost and gave me a motivation to take pediatrics. Suppose I want to settle in a medical college, then I can do SRC for pediatrics. If I want to continue my shades, I can also do DM in pediatric super specialties like neonatology or pediatric cardiology or maybe pediatric nephrology. Now all DMs are available in pediatrics. Or I can do even adult DMs. So this is also a fact. I think few of them don't know. After pediatric MD, you can actually do DM adult. So maybe I didn't like pediatrics at the end of my MD residency, but then I want to change my option. In medicine, I don't have this option. I just have to select any other adult branches. But pediatric provide this flexibility. And then there are many fellowships available. There are many fellowships available. This fellowship will give you a unique identity, like pediatric neurology. Even with the fellowship, you can brand yourself as a pediatric neurology. DM is not actually required. So now the many people ask like DM for pediatrics is also necessary because there are many courses upcoming. But for the next upcoming 10 to 15 years, DM is not necessary for pediatrics. MD is more than sufficient. But in tier 1 cities, now there is an increased need for DM pediatrics, especially in cities like Delhi and Mumbai. But still, many of the cities, there are ample opportunities for DM candidates. So it is not going to saturate very soon. Okay. So you have this window of 10 to 15 years. Okay. So whenever you think about this life decision, you should always think 10 years ahead. So I had, whenever I took this decision about medicine versus pediatrics or anything, I had thought about my life 10 years ahead, what I want to do 10 years ahead. So that's how I came to this conclusion. Okay. Then coming to income part, medical super specialties earn more than pediatric specialties. So it is not that it is a true fact, but you can also find very rich pediatricians. So this is a general consideration. Okay. Then coming to pediatrics, you will need to have more patience, and the responsibility is actually more. Okay. So in medicine, it will be like your first year will be very hectic, then second, third year, you can actually rely on anyone. Like you can tell your juniors to tell, like you can tell, like you put, please put this, start this patient on these drugs, etc. But pediatrics is not like that. You should be physically present there, whatever happens to the patient. And many pediatric departments are toxic for this reason, because each kid is your responsibility. Each, whatever happens to that kid is your responsibility. Okay. But no one is going to touch that kid. This is also an advantage for a pediatrician, because whenever in a when a medicine case comes, that patient might have gone to 2 3 Ayurveda or homeopathy specialist, some other specialist, some other quacks, and then he would have come back to you for his treatment. But the pediatrics, always they'll come to pediatrician first. They'll search for a pediatrician and they'll come. Okay. And you should be then the few people ask, and even I had this question. So I'm not good with kids, and I'm not good at fine skills. Like I can't insert cannula, I can't prick small kids, I'm hesitant, I can't do so minute procedures, and all my fingers shake. So will this be a problem? Can I take pediatrics? You can definitely take, because these skills are to be learned over time. No, if you're born with it, then it's good, it's talent. But then these skills are actually learned over time. It comes with practice. Like I'll give you my example. I was not very good at dealing with kids, and I was not initially good with fine skills. But then over practice, now I can frequently deal with kids, and the satisfaction that you obtain by dealing with kids is like that satisfaction you won't obtain in any other branches. That is for sure. So these skills will come over practice. Okay, so you don't have to worry about this. So now this is a more personal question, which many people ask me. Like, you had the option to choose both medicine and pediatrics, you would have got any peripheral college. Actually, you could have got any good peripheral colleges in Kerala or Karnataka, but then why did you choose pediatrics over medicine, and why did you choose Delhi especially? So I'll answer it here itself. So for a rank of 800, I would have got all this till second round. But then as I said, I had some self thinking about what I want in my life, and where I'm uh, uh, where I'm imagining myself in the coming 10 years. So first of all is the flexibility that pediatrics provides. That is, you can actually settle anywhere you want. You want a corporate setup, you can settle there. You want to settle in rural areas, you can settle there. I could actually settle in my hometown, because pediatrics has very good scope there, and super specialty is as such not needed at this point. And one more thing is that during with this super specialty and residency, you will actually lose your youth, your youthful years, your years from 25 to 30, that 30 35, that will be lost when you're doing super specialty. So I don't want to do that. I want to enjoy my youth. I want to be it's a personal decision. If you're passionate about something, if you want to achieve something in life, then you should definitely go ahead with your choice. So this was more of my personal decision. And one thing which I observed was that top rankers, especially within 1,000, always every third person out of 5 persons prefer medicine. they prefer medicine. I don't know whether it is blindly or the effect of some TV series or some drama or something. When you actually go into residency, you will realize that medicine is nothing like TV series. You don't get diagnosed instantly. You don't diagnose rare diseases. It is very hard to diagnose. It is very difficult to deal with patients. It is very difficult to manage with hospital setup. It is very difficult to counsel. I haven't seen any TV series or drama or anything which deals with patient counseling as such. So patient counseling is such an important thing, which I realized after coming to residency, but this is not dealt anywhere. So these are minute things which are not, which you won't understand unless you come into actual practice. So don't be just passionate like I want to diagnose like house MD, or I want to be like this person, I want to be like this, and I want to diagnose cases, so I'm taking medicine. So over a period of time after taking residency, you'll realize that it's actually not what you think it is. So it is totally different. Okay, so unless you have a proper idea about that, and if you're passionate about that, then it's not a matter. But then don't be carried away with this. Like, I want to be a cardiothoracic vascular surgeon because it is very cool. I want to be a neurosurgeon because he earns a lot of money. So these things are like to be considered before you actually take up a branch, because imagine yourself 10 years later over the lane. Imagine what you'll be doing after 10 years, what you need in your life, what you want to do after, what you do want to do later on, because whatever the decisions you take today will have consequences later on. Okay, and third one is stipend and bond. One factor which I can say, I think this is necessary because bond is one factor which hinders your skills, hinders your progress, I can say. Because if you want to do DM, especially this is true for medicine, if you want to do DM, or when you're not sure whether you want to do DM or not, so it's better you don't have a bond. So try to choose colleges which don't have bond. And for pediatrics, especially, I'd say a college with a bond is fine, because you can't gain all those skills within 3 years. You can't have all those knowledge within 3 years. Even for medicine, it holds true. So 1 year of bond is still fine, but having a bond for 2 years or more than that, unless you are planning to settle in that state, is not at all good. That's why I had not kept Tamil Nadu colleges, even though they are very good colleges for medicine, especially colleges like Madras and Stanley for pediatrics and medicine. They are really very good. Madras ICH is one of the best pediatrics department which I know. So because of the bond factor, I didn't consider this. Also coming to stipend, see, these are the youthful years of your life. So whatever you earn here, you save. If you're getting a low stipend, it won't be enough for, by the end of 3 years, you won't be saving anything. So when you do anything, you should be thinking for your future also. You should be thinking 10 years ahead the line. You should be thinking 15 years ahead the line. I even have plans now what I will be doing 10 years later. So when you have this focus, you will be knowing what you actually need in your life. Okay, so this was actually a personal decision of taking pediatrics, and I'm not regretting this. I'm actually liking pediatrics, even though initially I had no interest in I had no expectation that I would take pediatrics, but then I ended up taking anyways, and now I'm very happy that I have, because of the extensive research that I conducted, and the amount of time I put into this. It took me almost 3 to 4 months just to come to this conclusion that I want to take pediatrics. Imagine, I had just two branches in my mind, medicine and pediatrics mainly, and it took me 3 to 4 months. So that shows you the amount of dedication and the amount of research, the amount of effort that you need to put in to decide your career. Because once you choose something from here, then you can't turn back. So choose something wisely, put all your effort. It's not like to get a branch, you see the neat cutoff of last year and you just ask someone, this college is good, that college. I've seen many people come to me, approach me, and they ask me, do you have contact of this college? And I ask, like, what are your preference of priority list? And they'll say, I choose this college, second this, and third this. And then after coming here, they will be regretting this, because once you come to the college, then you'll realize that nothing is great, because nothing there is nothing of that sort which you expected, especially when you come with the idea of that you're coming to a central institute. So you'll be expecting that all things are computerized, like all reports are digitalized, doctors are doing only doctors work, nurses are doing nurses work. No, this is not true. Even in AIMS Delhi, residents will push the trolleys, just as it happens in state colleges. There is no much difference in any government colleges in across India. So even if the topmost institute, it is the same. So I have this very good or bad habit, I don't know. I always talk to many PGs, my contemporaries who are doing PG in other institutes in other states. I have Sorry for the interruption. So I have talked to almost every pediatric PG across the most like good institutes, and then I have come to this conclusion that whatever the NEET cutoff, which is whatever toppers take, is actually a wrong decision. Because I myself have talked to people from MAMC who had taken pediatrics because their rank was good, they could have got any college, and now they regret taking MAMC as their first attempt when they could have taken other colleges. Because after going there, they have realized the true nature. I'm not saying that it's not good college. It is one of the best college. But when you actually prioritize your priority list, or when you know what you want in your life or what you expect from a college, so that expectations change when you enter a college. So everything has its own merits and demerits. Many things can go unexpected, but you can decrease the probability of unexpected things to happen if you plan properly. That is what is called proper planning, future thinking, and execution. So you should be having a long-term planning. That's why I focus many times on the thing that gather information from each college. Gathering information is very good, very useful. Prioritizing the college is very useful, because once you take that college and you don't know anything about the college, I have seen people who have gone till a fourth round of counseling, and then they got medicine by chance in a very good college, like one of the top college in the state. I'm not going to say the name, and then they went there, and it was very toxic, and the working conditions were inhuman, and they had to leave the seat. There are many such colleges. So unless you have proper information, because this is life-changing decision, you have struggled so much for us for such a good rank, and then you have come here, and now you have 1 to 1.5 months time. So extensively research about everything. Think about yourself. Think about your life. Think about what you want to do. Think 10 years ahead of your life, and then you will not regret what you have taken, just like I have done. So thank you, and I wish all of you all the best. May all of you get a very good college, and if any kind of help you guys need from me, I am anytime ready to answer your doubts or queries.